this morning, Tánaiste, that there are 90 on trolleys in UHL. That's a good day now. It would be unthinkable a number of years ago, but there are 90 this morning. Almost a quarter of everybody in trolleys in the country is in UHL. Now, you're a Republican, or you claim to be a Republican. Almost everybody in this House claims to be a Republican. But one of the key aspects of republicanism is equality. And there's a disparity in healthcare across this country. People's experience of UHL generally is quite good, other than the A&E, where people's experience is almost universally negative. And it's unfortunate because that's most people's many people's only encounter with the hospital. Now, I suppose I'd ask why that disparity continues to exist. I see Deputy Donnelly, I raised it with him. He told me there were 2,000 new posts since this government came. When I asked UHL for a breakdown on those, I found out that there's actually only 2/3 of that figure. Now, I welcome the fact that there's over 1,300 new posts. I do, I welcome that. It's not quite as good as what the Minister is claiming, but it is a big improvement. But nevertheless, the disparity continues. UHL management say that they have 13% less staff than other comparable Model 4 hospitals, and they have a 13% higher population to deal with less staff. They also point out there are more than 20% more people over the age of 70 in their catchment area, which bring, of course, additional requirements on the hospital. So what will be done in this republic, under this Republican government, to bring about an equality of healthcare across this state? Because the people I represent are not second-class citizens. They're not first-class citizens either. There are no first and second classes in this state. But there's a disparity. I've been to A&Es with family members in Dublin. And I've been to A&Es with family members in Limerick. And there's a massive disparity in treatment. It's huge. And I don't think some members of my family are first-class citizens and some of them are second-class citizens. It's unacceptable, and it's it's very much concentrated in the Midwest. And I want to know what your government, what your Minister for Health, you appointed a Minister for Health, still the Minister for Health, so what your government, because I argued that you take it into the Taoiseach's office at the time to sort this out. You didn't. It may be beyond any Minister for Health to sort it out, but it does need to be sorted out, Taoiseach, because the A&E in Limerick is unfit for purpose.
Could I first of all say, through the Chair again, that the University Hospital Limerick at the moment has the largest capital investment programme at the moment, is my understanding, in terms of new projects that are in the pipeline. I think the Minister has indicated that to me. So, but a lot of that has to happen in terms of getting, as you know, work on the new 90 million project, consisting of the 96-bed inpatient block and the renal dialysis unit commenced in October of 2022, of last year. And then the government is also committed to the delivery of a second 96-bed inpatient block at University Hospital Limerick. That will make a difference. And 150 additional beds have been opened in the University Hospital of Limerick since the 1st of January 2020. And in the UN Hospital Group, 98 of those in the hospital itself in UHL. The 2 million purpose-built injury unit at Ennis opened in April of 2022. Whole-time equivalent staff has gone up, well over 1,000 more. The budget has gone up by about 19% since 2019. That was the 22 budget was up on that. A new geriatric emergency medicine unit was opened, again with a focus of preventing ED attendance and admission for over 75s. And there was new plans announced in terms of one of the UHL again being one of the 5 regional scheduled care hubs. And then there's been work on Croom Orthopaedic Hospital as well to take pressure off in terms of theatres, wards, clinical areas. In respect of A&E generally, it's my view that there needs to be a focus as well, not just on resource allocation, Deputy, but on organisation of emergency medicine in the country. And that has to happen at hospital level. and there has to be a whole of hospital involvement in emergency medicine, with all of the departments and disciplines, if you like, working to take over cases within emergency departments, and likewise within the HSE itself. And very often the A&E becomes the focal point of public outcry and anger, because it's, as you said, for many people it's the first port of call in respect of their experience of hospitals. But we have developed many alternative care pathways now, from first responders right through to primary care, to enhanced community care, to the medical assessment units. And ultimately in all care, the sooner we get a patient to the person who can meaningfully treat that patient with the requisite qualifications, the better. And it's my view that to a certain extent, and this is going on for a number of years, the unrelenting focus on A&E sometimes misses the point of the broader hospital environment and the broader reform agenda that's required.
Yeah, thanks for your engagement, Tánaiste. That's greatly appreciated. I suppose you're right, there are a lot of things underway in Limerick. There are also other projects underway across the state. For example, in St. Vincent's, they're sending out teams. Instead of having elderly people coming into the hospital, they're sending out teams. And I just wonder if something like that could be considered for UHL, given the age cohort of the population of the Midwest, because it certainly seems to be a success in Vincent's, and it's something that might well help a lot of people in the Midwest. You talked about a whole of hospital response, and I agree with you, but even beyond that, I think there has to be a whole of hospital group response. And since I've come into this Dáil in 2020, I've called for a greater utilisation of Ennis, Nina and St. John's. Because the reality is, if a young man or woman, and it's mainly young men and women play sport, have an injury at training at night time, they're going to end up in UHL, because the local injuries unit, they stop at 8 o'clock at night. Even an additional, I have proposed in a motion of this Dáil that they be 24/7. As a movement towards that, even if they were open until 10 o'clock, it would bring a lot of benefits and alleviate a lot of pressures on the emergency department in UHL.
And in terms of alternatives, I mean, sporting injuries, unless they're very serious, should not automatically end up in the emergency department of UHL. The Minister has said to me, I know in Cortagrán, the Braher Centre has become a phenomenal service in terms of the injury unit. No, but there is injury units in the Midwest, and they're going to be expanded. And I think you're right. That's to me elementary, and should be pursued. There's also the pre-hospital pathway now, alternative pre-hospital pathway that's been developed since September of this year between LHG, that's the hospital, and the National Ambulance Service, which will see definitive care provided in the community to patients who call 999 or 112, and reduce the numbers of ambulances bringing patients directly to the emergency department. That involves specialist emergency medicine doctors and National Ambulance Service personnel responding to low acuity ambulance calls. But again, that's 10 a.m. to 6 p.m. We've got to work to expand the length, but it's a very good service and a very good idea. The medical assessment unit pathway, again, is for 112-999 patients in Ennis and Nina hospitals. They've been that's now been extended to St. John's Hospital. And generally speaking, I agree with the thrust of your argument.
Thank you, Tánaiste.
And a lot of that work is underway.